Are you struggling with achieving or sustaining erections? If yes, you're not alone. Erectile dysfunction affects over 30 million men in the United States of America and 1 in 5 men across the United Kingdom. The current estimate is 322 million men worldwide, and this is on the rise. Across Africa, up to 30% of men above the age of 40 have some form of erectile dysfunction, and this rises exponentially in the presence of chronic diseases like diabetes and hypertension, as we shall discuss in a bit. So what exactly is erectile dysfunction and why is it important? Erectile dysfunction, simply put, is difficulty getting or keeping an erection firm enough for sexual intercourse. It is vital to fertility, self-confidence, mental health, and quality of life. Do you know that erectile dysfunction is linked with increased risks of cardiovascular disease, dementia, and early death? It is indeed serious and therefore important to talk about it. How does an erection occur? During times of sexual arousal, certain chemical processes cause an increase in blood flow to the penis. Anything that interferes with this chain of reactions can lead to erectile dysfunction. Erections are perfectly natural and important, so understandably, it can be quite upsetting when a man suffers from erectile dysfunction. As causes can vary significantly, it is very important to determine the root cause of every individual case in order to treat it properly and promptly. Let's take a look at the common causes of erectile dysfunction. Chronic conditions like diabetes and heart disease put men at significant risk of developing erectile dysfunction. Less commonly, when the pituitary gland in the brain is damaged, such as from a tumor, injury, or certain diseases, it may not send signals to set up the necessary chain of hormonal reactions that cause the testes to produce adequate testosterone, even when the testes themselves are healthy. The resultant effect is a reduction or loss of libido, reduced muscle mass, and erectile dysfunction. Diabetes is a particularly important risk factor for erectile dysfunction. Therefore, let's consider the statistics. On a global scale, erectile dysfunction occurs among 65.8% of diabetic men, while 62.9% of diabetic men in Africa experience it. If you have had diabetes for more than 10 years, are over 40 years old, are obese, or have circulatory problems, you have a higher risk of experiencing erectile dysfunction. In the absence of physical illnesses or conditions, psychological conditions like stress, anxiety, or depression, and certain medications can interfere with your ability to get an erection. Therefore, if erectile dysfunction lasts more than a few weeks, speak to a doctor. Erectile dysfunction itself can be a warning sign of underlying health problems. Sadly, many men are ashamed of talking about it, and health professionals need to work with the public to remove the stigma that surrounds erectile dysfunction. There are treatments available, from lifestyle changes, diagnosing and treating or controlling chronic diseases, to medications, therapy, and in rarer cases surgery, depending on the specific cause. The good news is that treatment actually works. There are things you can do for yourself to prevent erectile dysfunction. It is very important to maintain a healthy diet and to exercise frequently. Controlling your weight is a way you can prevent and fight diabetes and heart disease. Good diabetes control prevents damage to your nerves and blood vessels, and so can prevent erectile dysfunction. Smoking is one habit implicated in a multitude of diseases, and erectile dysfunction is no exception. Make a commitment to quit smoking today, and it is equally important to avoid being a passive smoker. Don't suffer in silence. There is help out there, and talking confidently about erectile dysfunction is the first step to getting a solution. Subscribe to the channel and be sure to watch my next video in the erectile dysfunction series, where we will explore examples of cases and discuss treatment solutions in greater depth.